Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Students, today I welcome you all to my weekly lecture. As far as hope you all are fine as far as corona epidemic is concerned, I would like to tell you that we have entered eighth week of this epidemic, and it has been observed world over that maximum cases and the birth death toll is seen during 8th to 13th week of epidemic in any country. Well, when now we are in this phase, I recommend all of you to stay safe, to practice social distancing, to advise your peers and family members and all others to practice social distancing and to cover your faces with your with face masks of any kind, of any quality, whenever you are going out and you are being exposed to the general public. I would recommend that all of you should advise your parents and those who are running home that you should order your groceries uh, online or through home delivery. And when you receive it, you must spray your groceries with some antiseptic solutions like Dettol surface cleaner mixed in water or Dettol mixed in water, so that the received products are disinfected before further use. And it's even better to leave them in open space under sun for like 2 to 3 days, because much of the virus dies on surfaces within 72 hours, and then you can use those products. So these are some instructions by which you can. And if you are going and attending your classes in healthcare settings, you must observe universal standard precautions for COVID-19 patients. You must assume that you are working with or you are dealing with patients who have COVID-19, whether they have it or not, but you must take all the precautionary measures. That includes personal protective equipment, masks, glass shields, etc., so that you may prevent yourself from getting infected. Now, our today's topic is low birth weight. As we have already discussed, that community medicine or public health pays for a special focus or special attention to the vulnerable groups. So, one vulnerable group we have with us is newborns who are born with low birth weight. Now, before commencing upon the details or of this topic, I would like to briefly introduce what is low birth weight, what newborns are classified as having low birth weight. So, as per definition, any infant with birth weight of less than 2.5 kg within 1 hour of birth, regardless of gestational age, is known as the child having low birth weight. Now, they are further graded as children who are between 2.5 to 2 kgs are classified as low birth weight, and those who are between 2.5 kgs to 1 kg, they are classified as very low birth weight, and those who have weight less than 1 kg are classified as extremely low birth weight. Now, with this things जो है वो they differ in terms of their management and mortality and morbidity, of course. Okay. Now, more than 20 million infants worldwide, uh, representing 15.5 of all births, are born with low birth weight, and that is quite a high percentage, which can be avoided very easily uh, through some specific measures, and these are very much preventable mortality and morbidity. And then prematurity is the world's single biggest cause of newborn death and second leading cause of all children deaths after pneumonia. and prematurity is one of the biggest causes of low birth weight. Now, what are types of low birth weight? There are two types based on their origin. One of the types is preterm. If the baby is born before the term approaches, and what is term? Term is completed 37 weeks post gestation, post last menstrual period, and then it accounts for low birth weight. Now it's more clear. Small for dates or intrauterine growth retardation is the second type of low birth weight, that is less than 10th percentile for gestational age, and account for two-thirds of low birth weight neonates. Prematurity या preterm birth accounts for one-third of the low birth weight, while small for dates or intrauterine growth retardation accounts for two-thirds of the low birth weights. Now, causes of low birth weights includes two groups. Number one is preterm, as we have already discussed, and the second is intrauterine growth retardation. In nearly 50% of the cases of low birth weight, the cause is not known. In remaining 50%, the causes are grouped into medical and social groups. And as we are dealing with community medicine or public health, we must take into account the social factors which can be modified by effective social interventions that we will discuss in our forthcoming slides. Now, first we will discuss medical causes. Now, medical causes can be divided into placental causes, maternal causes, and fetal causes. Now, in maternal causes, all the high-risk mothers except diabetics. In diabetics, there is chances of big-sized babies or good-sized babies, while in rest of the conditions that affect mothers, there are chances of intrauterine growth retardation, and the biggest and the foremost is hypertension, whether it is pregnancy-induced hypertension or the hypertension that was already there before conception. In both these cases, it results in intrauterine growth arrest or growth retardation. And then we have placental causes. Placental causes include placenta previa. What is placenta previa? Placenta previa is a condition when placenta is implanted in lower segment of the uterine wall, and it may also cover partially or completely the internal os or congenital defects of placenta, etc. And then we have fetal causes. Among fetal causes, there may be multiple gestations, hydramnios, intrauterine infections, etc. Among social causes, the first and the foremost thing is poverty, then lack of education or illiteracy, or ignorance regarding diet, prevention of infection, hygiene, workload, birth spacing, etc., etc. That is combined under the term ignorance. And then poor standard of living, that is again associated with poverty and illiteracy. Lack of knowledge on family planning, because birth spacing has a very important role in low birth weight, because the incidence of low birth weight increases as the period between two consecutive births to the same mother decreases. Early marriages, smoking, these are various factors which socially makes a mother vulnerable to deliver a child who has low birth weight. Now, how do you care for low birth weight babies? Those who are between 2.5 and 2 kgs should have special care at home. What kind of care is that? Temperature should be maintained, special focus should be given for temperature maintenance, and the child should be fed properly. And the children who have birth weight less than 2 kgs or 2000 grams require special care at hospital, that is incubatory care. And if the weight is between 2 kgs and 1.8 kgs, they are stable hemodynamically. They can be sent home, but kangaroo mother care should be ensured. Now, what is kangaroo mother care? I did discuss this care in my last lecture as well, and it is one of the important university questions that can be asked by university examiners. Kangaroo mother care refers to the care provided to the child who is either preterm or has low birth weight and requires assistance for maintenance of temperature and other important parameters. And in addition to all this, the community is not resourced well to provide incubatory care to such a newborn. So, in that case, one very cost effective strategy is kangaroo mother care. Now, how has the term been coined to such a care is through the animal kangaroo. Kangaroo keeps its newborn in the pouch that has been created by God over her belly. So in kangaroo mother care, the newborn is kept skin to mother. By doing this, you ensure that through skin to skin contact, the baby's temperature is maintained. And another important aspect of kangaroo mother care is provision of breast milk. So, in addition to the skin to skin care, breastfeeding is ensured in kangaroo mother care. Third thing is that kind of care is ambulatory care. Whenever the mother is moving, she's roaming around, she's doing other works, other chores at her house, she is keeping her child to her skin, and the cloth is wrapped both around her and the child, the newborn child. So a mother gives the care 24/7 and the care is ambulatory. And the fourth aspect is that both the mother and the child is provided care at homes by healthcare providers through frequent visits. That is, daily visit in the first 7 days of life and then weekly visit till baby gains weight and is maintaining weight and temperature. After discharge, kangaroo mother care is continued at home. Follow up is done daily by healthcare worker for 1 week and ensure that baby is feeding well and gaining weight, that is 40 grams weight daily. Afterwards, once a week till the baby reaches 40th week post conceptional age. Right? So that is how you ensure care of low birth weight baby in lesser resourced settings. Now, what interventions can we do to prevent or reduce the incidence of low birth weight in communities and societies? By recognizing and treating the risk factors that makes a woman vulnerable to deliver low birth weight child, we can help reduce the incidence and reduce morbidity and mortality related to the low birth weight. And what are those interventions? Those direct interventions, we should promptly early diagnose and promptly treat infections. We should manage blood pressure and we should not let hypertension sets in. And if the hypertension has been induced during pregnancy, that is pregnancy induced hypertension, we should manage it there and then. And if expertise or facilities are not available, we should promptly refer mother to the FRU, that is first referral unit available, where skilled work staff manages pregnancy induced hypertension well. We should always ensure that a mother doesn't have that much of the workload in her daily routine that hampers woman's general health, like her rest, her diet, her state of mind, her overall relaxation and stresses, because increased workload and heavier workload can sick of mother to ignoring her own self and thus affecting her child's development in her womb. Then we should ensure that the pregnant female is well nourished according to the calories requirement due to pregnancy. How many calories are required? Additional calories due to pregnancy, that is around 500 kilocalories. And how much calories are required by a female that is non-pregnant? That is 2000 kilocalories. And if she's pregnant, she requires 2500 kilocalories, and if she's lactating, she requires 3000 kilocalories. You should learn this by heart because these questions are both asked in Viva Voce as well as university questions. Now, what are various indirect interventions through which we can reduce the incidence of maternal mortality, low birth weight. It has been seen that if the age of the mother is less, she is more likely to deliver a low birth weight child because her own development is not complete. She herself is growing, and when she takes the responsibility or the work of uh, nourishing a child, nourishing a fetus in her womb, that adds to the overall physiological burden on her, and she may not be able to do it effectively and efficiently, and hence there is an increase in the incidence of low birth weight. So, if the age of marriage is delayed till an appropriate level of physiological development and growth is completed in the female herself, only then she should start reproduction. And then, how can it be ensured? It can be ensured by delaying marriage first. A marriage should be delayed at least after 18 years. And then the next thing is, sorry, if marriage occurs early, then first pregnancy should be delayed for at least a time when the female herself is minimal of 18 years of age. And after that, a woman must ensure a gap of 2 to 3 years between two children. Initially, it was said that there should be a gap of 2 years, but now it is recommended that a woman should have a gap of at least 3 years between two births, because the period of lactation is 2 years, and then for 1 year she needs to replenish her stores, recover from the stresses of pregnancy and lactation, and then she should go for the next pregnancy. So the spacing between two children should not be less than 3 years. And then deciding number of children, it must be ensured that number of children should not be too high that puts women at risk of malnutrition, and the children born to her to other diseases like low birth weight, which itself is a cause of high infant and neonatal mortality. And it should be ensured that maternal and child health services are available in any community, because it is a one sole important factor that has a crucial role in deciding the fate of overall maternal and child health in any community, and so is this condition, that is low birth weight. All right, students, With this, we end our today's lecture, and I also announce an MCQ test for next week. You should prepare the topics maternal and child health that has been covered by me, and the topics that has been covered by Dr. Sara and Mr. Danial, and we will upload an MCQ test, and you guys will have to give your responses and submit it on the group, and you will be graded for that. So I hope you guys have not lost your pace of studies. Rather, you should use this time to effectively learn, not through conventional lecture theatre teaching, but also through problem based learning. Online lectures and online sessions are there to guide you, but in your own skin, you should try to enhance your knowledge and skills for all the subjects through any means available and possible. I wish you all a healthy life, and I pray that our country and globally this pandemic vanishes and we all return to the activities. The world resumes its pace. My students resume their conventional studies. I resume my office, and we all work towards medical profession and medical education the way we used to work before. Good luck and goodbye. Thanks a lot. Stay safe and stay at homes.